Chapter 10, Respiratory System, Screencast 4. Now, this screencast will be focusing on two things, so the overall control of breathing and disorders of the respiratory system. Now, within the brain, there's actually a respiratory center within the medulla, and that's actually where our breathing pattern is established. And generally how this works, the neurons within this area of the brain generate these impulses, and they fire every 4 to 5 seconds. Now, these impulses are moving to the intercostal muscles and the diaphragm, and that's responsible for inspiration. Remember, this requires muscular effort. Now, any disorder that interferes with transmission of these nerve impulses will affect breathing. If you have a relatively high spinal cord lesion, perfect example, Christopher Reeves, famous actor, had an equestrian accident, thrown from his horse, and ended up having a very high up, I think it's about C3, and he was actually a quadriplegic after that accident and spent his time afterwards on a ventilator because, once again, because of the nerve lesion, he was not able to activate the muscles of inspiration. So he needed assistance through the machine to do that for him. Now, when we talk about CO2 levels, this is really important here because what I want you to be comfortable with, it's an increase in CO2 and not a drop in oxygen. That's the primary drive for ventilation. Now, within the medulla, there's receptors that are responsible for monitoring CO2 levels, and this is done indirectly. What these receptors are really looking at is monitoring hydrogen ion in the cerebrospinal fluid. And if there's an increase in the partial pressure of carbon dioxide, that will in turn cause a rise in hydrogen ion or a decrease in pH. And that will actually signal the medulla to increase respiratory rate. So typically, this is the primary regulator of respiration under normal conditions. Now, when we talk about partial pressure of oxygen, that is going to be monitored in what we consider to be the peripheral chemoreceptors. Those are found in the aortic arch and the carotid bodies. And here, oxygen has to fall quite a bit, at least 20%, before it actually will stimulate an increase in ventilation. So oxygen levels need to be especially low. And what I want us to keep in mind here, the rate and overall depth of our breathing pattern is determined more by the need to get rid of carbon dioxide than it is to obtain oxygen. So that's something I want to make sure that you're comfortable with. Now, we do have a limited capacity to actually control our breathing. So there is conscious control here, and that's within the cerebral cortex. And I'm sure you've all had this contest where you try to hold your breath the longest, okay? There's actually a sport known as free diving, and these guys are pretty crazy because they've been known to hold their breath, dive as deep as they can on a single breath, come back up, and some of these athletes are able to hold their breath for up to 4 minutes. So that's pretty significant. Now, we can also look at how we modify our breathing, and that allows us to speak and sing. And as I said earlier, we typically also can hold our breath temporarily, but what eventually will happen, there's going to be an override, and we'll start breathing again overall. So you can't just hold your breath indefinitely. Here we basically see what's happening as far as the respiratory control center. Okay, and as I said before, we've got these receptor cells here, and they're responsive primarily to changes in hydrogen ion that are due to an increase in CO2. And so what we're going to see here is the output to the external intercostals and the diaphragm overall. Here, okay, if we look at the aortic bodies and the carotid bodies, these are the receptors primarily for oxygen. And once again, remember, oxygen levels have to drop pretty significantly before they actually impact ventilation. The primary drive for ventilation is is an increase in CO2, and that's primarily due to the impact it has by increasing hydrogen ion or decreasing pH. Now, there are a number of diseases out there specific to the respiratory system. Asthma, this is actually due to a spastic contraction of the smooth muscle within the bronchi. This can be due to a number of things. A lot of people that have allergies, that's very common. And generally, asthma is treated using bronchodilators. So I actually have asthma, so I am on both of these medications. I take an inhaled steroid, and also my rescue inhaler is a fast-acting bronchodilator. Now, emphysema, that's a disease we primarily see in individuals that have a history of smoking. In this particular situation, the alveoli are permanently impaired, and they have a real problem with exhalation. You may hear it describe someone that has emphysema as barrel-chested, and that's, once again, think of the volume if all the alveoli are basically expanded. They don't have the ability overall to collapse, and people with emphysema have a lot of problem with exhalation. Now, bronchitis, whenever you see itis, that's some type of inflammation, and this is generally an inflammation of the bronchi. This can be due to a number of reasons. It may be an acute bout, or it may be a chronic condition. And if we look at the majority of cases, they're related to one of two things, air pollution or smoking behaviors. Now, cystic fibrosis, this is an inherited condition, and this is actually a restrictive disease. And one of the things that is hallmark of these individuals, they have a abnormally thick mucus within the lungs, and that actually impedes the flow of air. Now, these individuals also are more prone to having pulmonary infections, and also there's some other organ systems that may be impacted by cystic fibrosis. And once again, this is an inherited condition. Now, many of us, upper respiratory infections, colds and flu, and these are caused by viruses. Remember that an antibiotic is not effective for a viral infection. If we look at pneumonia, that's an infection of the lungs, and that can actually be caused by bacteria or viruses. And it is one of the top 10 causes of death in the United States, and the treatment depends on cause. But of course, now we have to kind of keep in mind COVID and the pandemic, because once again, that has a lot of respiratory issues associated with it, coughing, potentially the need to be on a ventilator in severe situations. So once again, I wanted to include this with viral infections of the upper respiratory tract, but once again, making their way into the lungs. Now, if we have tuberculosis, this is actually a bacterial infection, and it results in scarring of the lungs. Now, this is one of those diseases that may actually be dormant and activated sometime later. And generally, I'm sure you may have had those skin tests, okay, to determine whether or not you have tuberculosis, or a chest x-ray. Typically, this is bacterial in nature, so antibiotics will be effective in these types of conditions. The type of tuberculosis that's most common right now, unfortunately, is resistant to a lot of the antibiotics that we use normally. Now, botulism, this is a poisoning due to a bacterial toxin. A really good example, it can be found in improperly preserved foods. That's a big cause of it. And basically, what it ends up doing, it causes paralysis of the skeletal muscles. Now remember, those skeletal muscles are necessary for ventilation, so this can result in death and respiratory failure. Now, cancer, and this is an uncontrolled growth of abnormal cells, typically epithelial cells. Epithelial cells have a high capacity to replicate, and generally what we see here, the cancer, what it does, it's going to impact airflow, gas exchange, and blood flow. Lung cancer accounts for about 1/3 of all deaths attributed to cancer in the United States. The majority, so about 90% of lung cancers, are associated with smoking, radon gas, or exposure to workplace chemicals, especially asbestos. Here we can actually see a normal lung, okay? And down here we actually see the cancerous lung of a smoker. And you can see once again the destruction of the alveoli and also the blood vessels. So pretty dramatic figures there comparing a healthy lung to the cancerous lung of a smoker. Now, mesothelioma, this is actually a cancer that's specific to asbestos exposure. Now, this is a very deadly type cancer, affects the lining of the lungs, the hearts, and the abdomen. And the real problem with it, the symptoms don't appear until 20 to 50 years after the actual exposure. So by the time it's actually diagnosed, this cancer is well established, and generally the life expectancy after diagnosis of mesothelioma is about 8 to 14 months. So year if you're lucky. Pneumothorax, this is associated with trauma, and what happens basically causes the lungs to actually collapse, and so they lose the ability to inflate, and you're going to have poor gas exchange. The treatment for this is actually to move the air from the pleural cavity, which has actually caused the lung to collapse. So this would be common, potentially a broken rib, stabbing, and so on. If we look at atelectasis, this is lack of gas exchange due to alveolar collapse or the buildup of fluid. This may be something that happened because of surgery, or if an individual does not have enough surfactant. Now, congestive heart failure, we talked about this previously, and when the heart is not a very good pump, on the left side especially, because you have all this extra fluid that the heart can't get rid of, what ends up happening is you see the buildup of fluid in the pulmonary system. And so now edema in that particular situation, but it's really going to have an impact on gas exchange. So generally the treatment here is going to improve function of the heart and get rid of that fluid.